What's up, everyone? This is Larry with Yunique Medical, and I want to talk to you today about hacking your sleep. So, people underestimate the value of sleep, good sleep. I'm not talking about how much you lay in your bed, I'm talking about the stages of sleep that you get while you're in bed. So, you're aiming for stage 3 or 4. This is when your body's going to recover. This is when growth hormone is pulsed. This is when your immune system is ramped up. So, this is a very important stage to be in. This will also help you crush the next day, so you'll be more productive and you'll recover from your exercises better. But most people don't prioritize sleep the way that they should. I know I'm guilty of that. I just recently started getting into sleep, and it's nice to be able to measure the quality of sleep because most of us don't know what stages we're in, and those were things like the Oura rings can come into play, and there's other cheaper devices out there. So I'm going to give you some tips that are relatively inexpensive or free that you can use to help increase your chances of getting into deep sleep. And then I'll give you some pro tips as well. So number one, you're going to want to limit your caffeine. So stop drinking coffee or any kind of caffeine after 11 a.m. in the morning. Now, I know for some of us that's going to be difficult to do. Some of us drink caffeine all day. I know I've been guilty of that. But it does interrupt the deep sleep at night. You just don't realize it unless you're tracking it or measuring it. That's number one. Number two, try to exercise in the morning if you can, not so much late at night. And if you do it late at night, I know that I like to work out sometimes in the evening, 5, 6 o'clock. But if you do it later than that, you're actually going to warm up the body. You're going to get the adrenaline pumping, and that's going to be, thermoregulation. And your body actually needs to be kind of calm, cool, and cold. So actually, the colder your room and the colder your body, the deeper the sleep is going to be. And then as the evening hours start to progress, so the sun starts to set, try turning down the lights in your house by 50%. So just start shutting off lights that are just unnecessary. And then wear blue light blockers like I'm wearing right now. So we're trying to limit the amount of blue light that's hitting the eye, the retina, because we don't want it to spike cortisol. When cortisol gets spiked, the body thinks it needs to be up. So we're trying to tone down and settle down everything. And same thing with your devices. So make sure that you're putting them on night mode so that it's blocking blue lights as well. So if you do that, it's synergistic. Your lights are down in your house, you're wearing your blue light blockers, and then your devices are on the appropriate modes for sleep. And then you're going to want to participate in some kind of parasympathetic activity. So we have the sympathetic, that fight or flight, and then you have the parasympathetic, which is the rest and digest. So we want to get the body into rest mode. So about an hour or so before bed, stop playing on social media, stop sending emails, stop stimulating your mind. I'm 100% guilty of working up until the late hours. So I've recently tried to do that less and less, and then read instead. That's what I've been starting to do. I like to read. So read, cuddle with your partner, cuddle with your dog, meditate, deep breathe. Do anything to start calming and relaxing the body, doing some stretching, whatever you need to do before you get into bed. Also while you're wearing your blue light glasses, etc. So those are some quick, easy things that can help improve your sleep patterns. And then more pro kind of things are, HRT, so hormone replacement therapy is gonna increase sleep, and I'll do a separate video on that alone on hormone replacement and sleep. Also, we use some peptides called delta sleep inducing peptide, or DSIP, in combination with another one called epithalon. Those two work synergistically to increase REM sleep. Also, the growth hormones, also work on increasing REM sleep. I know that it has in me, but by about like 10%. So that's pretty good when we're talking about deep sleep. So those are just some other things that you can explore. I hope these tips help you. So get out there and get optimized, everybody, and do the work.